let's come to the acupuncture treatment. Acupuncture treatment, we still introduce some acupoints here. And these acupoints, like UB1, Sanjo 6, stomach 1, and lung 4, LI 4, liver 1, GB1, Sanjo 23, GB 37. So this is pretty common points. We always use it for the eye problem. For the wind heat, of course, we have to expel the wind and heat. So we could use DO 14, LI 11, GB 20, or like, some extra points, And for the wind fire in the liver channel, we could clear wind and fire, use Baksu points, okay, and GB8 and something like that, okay. And for the Damp-Phlegm, due to the spleen deficiency, we could use UB 20, 21, spleen 9, GB 34, stomach 2, and GB 14, something like that. That's just the general recommendation. Or endogenous fire due to the indeficiency, we could use, UB 18, 23. This is the Baksu of the kidney. All right, kidney 3, 6, UB 42, GB 38, heart 7, and Xingming. Xingming is extra points. All right, he makes extra points right down on the head, this area, for the eye conditions. So this is symptomatic points. Okay, so this is a general acupoints, all right, for this kind of a condition, okay. And clinically, if we use it more or less, they all have some results, okay. And let's just switch to the next part, other acupuncture points. Other acupuncture treatment include auricular or some formula for nebula, okay, some formula for nebula. The reason of this because I'm really interested about nebula, and I spend so much time try so many points, but some points is so exciting, and but some is not. There's a lot of chance of acupoints was recommended by the Asian book, but somewhat I totally cannot see any results. And okay, let's start from auricular. Auricular acupuncture, we could choose the liver, kidney, spleen, I1, I2, and ocular points. So you already know, middle of the eye drops, ear drop is ocular points. Right around this notch, on both sides is ear 1, I1, I2. Okay, so this is a pretty common points for the eye condition. All right, so we always use it. So in clinic, if people have this eye condition, you always use it. It's kind of help. All right, it's not, but sometimes you cannot tell. It could be immediately reaction happen, but mostly long-term reaction. All right, so let's see several points I'm gonna try to recommend for the nebula. So the nebula is it's a kind of scar tissues in cornea. And okay, so Mostly for the nebula, but here I still have a point. I already mentioned before. So if people has a severe pain, because if a nebula is pretty active in the corneal area, the pain is very sharp. So if this pain is so sharp, we could use the middle finger root, right on the root of the middle finger, you could use the probe to find the tender spot and the needle on it. And we could make this pain better. All right. So a lot of needles could make eye pain better. Okay. And let's see. The second point I'm going to recommend is called 见阳 first. 见阳 first is right down here. Okay. The location of these points is right on the root of the natural nasolabial growth, the root top of this. And another point is looks like LI20, the points right on between. Still, we have to mention the points right down here, right? Between the top of the nasolabial growth and LI20, the point right on the middle. Okay, treat always on the same side. You put left eye pain on the left side, right eye pain on the right side. So if we put a needle there, they could control the pain in the eyes, especially like a cutting pain, always good. So I used to use these points for the people after cataract surgery or, some surgery in, the corneal transplant. These points actually works for the pain. Sometimes have very good results. Okay, and also some point, if people has the ophthalmia, we could use Li14 to 25 on it with a stronger stimulation. Sometimes it's pretty useful. The labia could be different shape. Here, I list a couple of them. You could try in clinic. For example, if a nebula looks like a flake or mist like, you could use bleeding therapy on the tip of the ear, or Sanjo 23, or UB10 on the back. Okay, so bleeding on it. All right, so this kind of releasing, I think this kind of flick and mist-like nebula, always because the injury just start. If this injury is so bad, lasts for long times, looks like a huge area already get affected, looks like a shit-like or auricular-like nebula, or could say panels. And mostly we like to use a back soup. This is a very smart idea. So I used to use the back soup points. And people had the eye problem. He complained of a back pain in the eye. And also we check on the back and see any tender spots on the back, sensitive spots on the back. And then we use needles, prick on it, make needle bleeding. After that, mox on it. Sometimes people, one of the doctors used to use called the 太乙神针 on it. Also pretty good. They could make your eye pain relief. So don't ignore about the backshot point. They always give us something surprising. Okay, always give us something surprising. And if people has a boil or hypoplians in the cornea, I could recommend you do this. You'll be 64, 65 and waiting for the surgery. Okay, waiting for surgery. And Moxa need to be help. This is not for cure, it's for help. Okay, ulceration, we could use Si2, 3, Sanjo 20, and do needle or Moxa. All good, all good. All right, so this is the treatment for acupuncture. This is treatment for acupuncture.